Welcome to the Explainer. So today we're taking what honestly looks like a pretty standard, maybe even a little dry clinical checklist, and we're transforming it into a dynamic, hands-on clinical encounter. We are decoding the cranial nerve examination. Specifically, we'll be walking through a highly structured assessment protocol used to evaluate sensory and motor functions, literally from the top of the head all the way down to the throat. Get ready to play along with me because we're going to simulate a real patient exam, right here, right now. Let's dive right into our agenda for this top-down clinical journey. We've got 1. The clinical toolkit, 2. Assessing face and jaw, 3. Hearing and balance, 4. Evaluating throat and voice, and finally, 5. Examining tongue function.
But before we even touch the patient, we need to gather our tools. Section 1. The Clinical Assessment Toolkit.
You know, you might think of a neurological exam as just a doctor with a reflex hammer, right? But just think about the incredible hands-on nature of this toolkit. You need everything from a stopwatch for precisely timing vocal duration, to specific food items to test the senses, to a torch for peering directly into the palate. It really is a multi-sensory toolkit for a completely multi-sensory exam. Okay, let's move to our first actual assessment. Zone 1, assessing face and jaw, covering cranial nerves V and 7. We begin with cranial nerve V, the trigeminal nerve. The clinician starts by focusing on the temporalis and masseter muscles. And the instruction to the patient here is incredibly direct. Close your mouth and bite hard. The clinician is quite literally feeling the bulk of those muscles right at the temples and the jawline to ensure they're firm and properly engaged. So the really crucial point here is how we divide the trigeminal nerve into two distinct pathways: motor tasks and sensory tasks. Try doing the motor task with me right now. Just clench your jaw tightly. You can absolutely feel those muscles popping out. The clinician tests this strength, and they'll even test jaw opening against the resistance of their own hand. But then, the exam completely shifts gears to the sensory tasks, which require the patient to just close their eyes and simply feel. For that sensory part, the clinician brings out a simple cotton swab. And notice the precision here. The stroke has to be done with firm pressure and kept completely consistent across all tasks. They stroke above the eyebrows, then above the upper lip, and finally between the lower lip and chin. They're meticulously mapping out the 3 sensory branches of the trigeminal nerve on the face to see if sensation is normal or if it's somehow affected. The overarching clinical philosophy at play here is basically a hunt for an exact binary. Is the response beautifully symmetrical and normal, or is there an asymmetrical reaction? Maybe a reduced strength, or in the case of the jaw, something called trismus, where the opening is restricted to just a few fingers' width. Make no mistake, symmetry is the absolute gold standard we're hunting for. Now we pivot to cranial nerve 7, the facial nerve. This one is highly interactive. I actually want you to try doing these next few steps with me wherever you are, starting right now by just wrinkling your forehead. The clinician is staring directly at your brow, looking for perfectly symmetrical wrinkling on both sides. Next up, smile as widely as you can. Here, we're assessing the orbicularis oris muscle and the labial muscles. Again, the clinician isn't just looking for a friendly grin, you know? They are clinically evaluating the range and the symmetry of that specific movement. And finally, puff out your cheeks and hold the air inside. This specifically checks the status and strength of the buccinator muscle. The clinician might even push gently against your puffed cheeks to really test that strength. It is a fast, highly effective clinical sequence that completely maps out facial motor function in a matter of seconds. But remember, the facial nerve isn't just about movement. It's got a crucial sensory component too. And this is where those food items from our toolkit come back into play. The patient closes their eyes, opens their mouth, and the clinician places salty, sour, bitter, or sweet materials directly onto the tongue. The patient then has to identify the taste, which confirms if those sensory neural pathways are fully intact. Moving down from the face to the ears, we reach Zone 2, testing hearing and balance, checking the vestibulocochlear nerve. This nerve essentially does 2 massive yet totally distinct jobs, and the exam reflects that perfectly. First, auditory sensitivity is tested by having the patient repeat a specific word list. We're looking for greater than 50% accuracy in their responses. Then, to test vestibular function, or balance, the patient is asked to walk in a straight line, keeping their feet close together with their eyes completely closed. The clinician is watching closely for even the slightest deviation from that straight line. Continuing our top-down journey, we arrive at Zone 3, evaluating throat and voice. Here we examine 2 heavily intertwined nerves, the glossopharyngeal and the vagus nerves. cranial nerves IX and X.
To evaluate the vagus nerve, we're checking swallowing ability, voice quality, and laryngeal function. The clinician uses that torch from the toolkit to illuminate the mouth, asking the patient to say "ah" repeatedly to check the symmetry of palatal movement. Then, they grab their stopwatch and ask the patient to say the "ah" sound for as long as humanly possible, noting the exact duration of sustained phonation.
Now, to test the glossopharyngeal nerve's motor and sensory innervation of the pharynx, well, the process is quite invasive but very necessary. The clinician explicitly follows these steps. Open the mouth, use the cotton swab to stroke the very back of the tongue and the facial arches, and observe for the presence or absence of a gag reflex. If that reflex is absent, they must ask the patient if they can at least feel the pricking sensation. This really teases apart the motor response from the sensory input. On the qualitative side of the exam, the clinician will simply say, "Tell me something about yourself." And while the patient speaks for a few lines, the clinician isn't really listening to the story itself. They're actually performing a perceptual analysis of voice quality. They are categorizing the voice into these specific clinical outcomes. Is it normal, breathy, hoarse, or gurgly and wet? Finally, we reach our last stop, Zone 4, examining tongue function, looking at the hypoglossal nerve, which is the main controller of the tongue. Before asking the patient to move it, the clinician just looks at the tongue resting wide open in the mouth. Simple observation is such a powerful tool here. They are meticulously checking for any structural anomalies. Is there a tremor? Are there tiny muscle twitches, which we call fasciculations? Is there atrophy or shrinkage? Or does the tongue abnormally deviate to the left or right side while it's just resting there? Then comes the dynamic test of strength and range of movement. Put your tongue out. Move it from one corner of your mouth to the other. Now push your tongue against your cheek right now to simulate the resistance of the clinician's tongue depressor. This simple act of pushing against resistance tells the clinician instantly if the hypoglossal nerve is providing normal symmetrical strength. We finish up this comprehensive exam by evaluating how well the tongue executes highly complex coordinated movements during speech. The patient is asked to repeat specific sounds 3 times each. The T and D sounds test the tip of the tongue. The I and J sounds test the tongue blade, and the K and G sounds test the back of the tongue. Ultimately, the clinician is assessing the overall quality and clarity of sound production. And that brings us to the end of our top-down cranial nerve explainer. But before we wrap up, I want to leave you with a clinical puzzle to test what we've just covered. Consider this scenario. If a patient has a perfectly symmetrical smile, meaning their facial nerve is fully intact, but they absolutely cannot feel that firm cotton swab on their chin, which specific nerve branch is affected? Think back to the very first zone we covered. Thank you so much for exploring this clinical toolkit with me. Review the cranial nerves again, keep asking questions, and I'll see you in the next explainer.